Okay, so in today's video I'll be taking the topic ear. So I'll be completely covering the entire ear, and for that I need to do this. Okay, so basically when we talk about the ear, it has got three parts. What are the three parts? We got our external ear, middle ear and our internal ear. Okay, so when we talk about the external ear, it has got again three parts. Basically it has got two parts, and then we also have the tympanic membrane. Okay, so when we talk about the external ear, okay, it has got two parts basically. We got the pinna and the external acoustic meatus. I really hope that what I'm speaking is audible, and that's the reason as to why I'm writing this. But if I'm not audible, I'm really sorry for that. So when we talk about the external ear, we got the pinna and we got the external acoustic meatus. So first off, let us start with the pinna. So the pinna is going to be this cartilaginous part, and this cartilaginous part is going to be comprised of the helix and the antihelix. Okay, so that's going to be the helix with the crura and the antihelix with its crura as well. And then this part that you see over here is going to be the concha. Okay, this part that you see over here is going to be the concha. This is going to be the tragus, and this is going to be the intertragal notch. So this is basically what we need to know about the pinna, and this is going to be the lobule. So when we talk about the nerve supply of this part, we can classify it into two parts. So one, we have the lateral part of it, and we have the medial part of it. So when we talk about the lateral part of the pinna, this lateral part is going to be having, we can divide it into two parts, the upper part and the middle part. Okay, so the upper part is going to be done, the innervation is going to be done by the auriculotemporal nerve, and the the lower part is going to be done by the auricular nerve. Similarly, in the posterior side as well, the upper part is going to be done by the lesser occipital nerve, and the lower part is going to be done by the auricular nerve. Let me just confirm it. So that is basically about the innervation. And the blood supply is also going to be very similar to the ones that we would have learned during the phase, the very first chapter of head and neck. In that we will learn the blood supply rate. That is what supplies the pinna as well. So 1 minute, let me take it here. So when we talk about the nerve supply of it, lateral surface, upper 2/3 is going to be supplied by the auriculotemporal nerve, and the lower part is going to be supplied, lower 1/3 is going to be supplied by the great auricular nerve. Posterior is going to be by the lesser occipital nerve and the great auricular nerve. Okay, so this is going to be about the auricle. Now moving on to the external acoustic meatus. So the external acoustic meatus is going to be an S-shaped canal. Okay, it's going to be an S-shaped canal. Okay, and this S-shaped canal is going to be like the lateral part of it. The lateral part of it is going to be like made up of cartilage, and the medial part of it is going to be made up of bony. The medial part is going to be made up of cartilage. No, medial part is going to be made up of bony. Okay, medial 2/3. The medial 2/3 is going to be made of bony, and the lateral 1/3 is going to be cartilaginous. Makes sense, right? Because this is going to be cartilaginous. So the lateral 1/3 is going to be cartilaginous, medial 2/3 are going to be bony in nature. So when we talk about this cartilaginous and bony parts of it, when we take a cross section of it, it is going to be C-shaped. Okay, despite the fact that this entire length of the canal is going to be S-shaped, when we take a cross section of it, it is going to be C-shaped. Okay, and the entire length of it is going to be 24 millimeters. Okay, it's going to be 24 millimeters, and the bony part is going to be made by the tympanic plate, whereas the cartilaginous part is going to be filled with fibrous tissue, and the ceruminous glands are going to be present. The wax producing glands are going to be present in this part of it. Okay, so I hope this is clear. Okay, so we got our external ear. This is going to be the pinna, and the external acoustic meatus, which is going to be for the 24 millimeters in length, and it is going to be an S-shaped part, and it is going to have the medial 1/3 is going to be made up of medial 2/3 are going to be bony in nature, and the lateral 1/3 is going to be cartilaginous in nature. And when we take a cross section, it is going to be C-shaped in nature. The bony part is going to be made by the bony part is going to be made by the tympanic plate, and the cartilaginous one is going to be fibrous in nature, and it is going to be ceruminous in nature. Okay, so that is about the external ear. And then when we come to the main part of it, which is going to be the tympanic membrane. So when we talk about this tympanic membrane, it is going to be this rubbery elastic kind of sheet, and it is going to be compressed. It is going to have a total diameter of almost 8 millimeters in length. Okay, so now this tympanic membrane is going to be seen in the lateral wall of the middle ear. Okay, makes sense, right? Now this tympanic membrane is going to be composed of several parts. what are the various parts in the sense? First, we have the outer cuticular layer. Okay, so basically what do I mean by this classification is, we have these three sheets. Okay, so it is going to be like this. So you take the tympanic membrane, then it is going to be like this. So first layer is going to be the cuticular layer, the middle layer is going to be the fibrous layer, okay, and the inner layer is going to be the mucosal layer. Okay, cuticular layer, fibrous layer, and mucosal layer. So these are going to be the three layers of our tympanic membrane. And then when we talk about the various parts of the tympanic membrane, then it is going to be the pars densa. Okay, pars densa is going to be there, and then there's going to be the umbo, which is going to be the most prominent part. Okay, and then we're going to have the pars flaccida, which is going to be wherein it is going to lie just over the handle of the malleus, and therefore it is going to be loosely held. Okay, we have the pars densa, we have the pars flaccida, we have the umbo, and we have the annulus. Okay, the annulus is going to be the one part which is going to separate the pars densa from the pars flaccida. Okay, so this is going to be annulus tympanicus, and we also have the malleolar folds. Okay, the malleolar folds. Now this is going to be about the parts of the this is going to be the parts of the tympanic membrane. Now when we talk about the blood supply of the tympanic membrane, we have the outer surface. Okay, the outer surface is going to be supplied by the deep auricular branch. Okay, remember like this, outer surface, so it is going to be related to the ear, so it is going to be deep auricular branch. The inner surface is going to be supplied by the tympanic branch, both anterior as well as posterior branch of the tympanic artery of the maxillary. Okay, anterior tympanic branch, posterior tympanic branch of the maxillary artery. Clear? Okay, no confusion, right? And that is about the tympanic membrane, and it is going to be present at a 55-degree angle when we see to the external acoustic meatus or the canal. Okay, so what all have you seen till now? The external ear is done. Pinna we have the external acoustic canal, and we have the external, the tympanic membrane. So this tympanic membrane is going to be comprised of three layers. What are the layers? Outer cuticular, middle fibrous, and inner mucosal layer. And then after that, yes, inner mucosal layer, and then after that we have the parts of it. Now we have the umbo, which is going to be the most prominent part, and then we're going to have the pars densa, the pars flaccida, the annulus tympanicus, and we have the malleolar folds. Yes. Now, when we talk about the arterial supply to this, we have the auricular branch, and then we have the tympanic branches, the anterior and the posterior tympanic branch of the maxillary artery. Okay, posterior branch of the styloma of the posterior auricular artery, posterior branch of the posterior auricular artery, anterior branch of the maxillary artery. Okay, now when we talk about the other parts of it, now we will do a quick overview over the clinical part of this external ear. So when we talk about the external ear, what are all the issues that could possibly happen? We have otitis externa, which could possibly happen. It could be related with the inflammation. Okay, and then after that there could be earwax that could be accumulated in the canal. Okay, that's one. And in order to remove that earwax, we use the Waxholz drops, and also syringing. Okay, syringing can be done. And then apart from that, when we talk about the tympanic membrane, in order to see the tympanic membrane correctly, we use this particular instrument called as the otoscope. Okay, the otoscope can be done, and myringotomy is also another way by which we drain the pus from the middle ear by incising the tympanic membrane. Okay, so how is it done? In the postero-inferior quadrant. Okay, it is done in the postero-inferior quadrant. And in order to see the tympanic membrane, how do we move it? So we're going to move the pinna upwards